One of the largest measles outbreaks is happening right now in America, and here's what you need to know about the measles. Measles is one of the most contagious viruses ever. It spreads through coughing, sneezing, and even just breathing because it's airborne. The virus can stay in the air for several hours, and it can infect up to 90% of people exposed to it. Symptoms may not show up until 7 to 14 days after exposure, and those symptoms could include a high fever up to 104 degrees or more, cough, runny nose, red, watery eyes, and most importantly, these red blotchy spots. And in rare instances, it can have long-term consequences seen 7 to 10 years later. These symptoms can be even worse in the very young, immunocompromised, or pregnant people. The good news, though, is that the MMR vaccine is 97% effective with 2 doses. Here's who needs the vaccine. Newsflash, everyone. But more specifically, if you're very young, if you're a child, or you have a newborn at home, you should definitely talk to your pediatrician and get them on the normal MMR vaccine schedule. If you're an adult and you're unsure if you have immunity, you can get what's called a titer to see if you still have immunity from a childhood vaccine. If you don't, you can get a booster series. If you become immunocompromised or if you're at high risk due to health issues, you should also talk to your doctor about getting a booster. Or if you're traveling to certain parts of the country or the world that are at high risk for a measles infection, you should definitely check your immunity and get a booster if needed. Unfortunately, the measles is back and we're having a really large outbreak right now, but there's something you can do about it, which is get immunized and stop the spread, wash your hands, and stay safe.